Country communities in Western New South Wales are facing a paediatric health crisis. Children are waiting up to 2 years for a health assessment. One of the things that Variety stands for is supporting children experiencing disadvantage. And that can be in regional communities a long way from primary health services.
There was that backlog for children seeing paediatricians, and I was on the waiting list for 2 years. Just trying to see them to get an appointment was a bit of a nightmare. I felt like I was failing as a mum because I felt like I wasn't giving him the right care that he needed, because I knew there was something up with him and I just needed the diagnosis so I could help him. So yeah, I felt like I was failing him. Yeah.
If you don't get at a young child level the support to address some of the challenges you face, as you go through life, they manifest and become worse and worse. Intervention at that very early stage is the crucial piece in the puzzle.
We're excited to be able to partner with Marathon Health and bridge the gap of unmet need in regional communities. The Variety Flying Start Paediatric Service brings a skilled paediatrician to visit communities in regional New South Wales. This program is a free service in their own community. Families and children that have been waiting far too long for the support that they need can start to move forward, get a diagnosis. That is the first step towards equitable healthcare.
I've worked in Western New South Wales for about 20 years. We know that there's critical workforce shortages in rural Australia. Bringing the clinical supports to the communities through the Flying Start clinics, it'll have a massive impact. And I think when you see the values alignments of organisations that really want to partner in community with community, that's when you see the real value add.
When I arrive, I have the most comprehensive set of reports that I really could ask for. That allows me to put together a clinical formulation, think that it's not just about the paediatrician coming in, it's about the paediatrician coming in with a team. So I'm working with allied health, the wind nurse, local education and the local GPs, and is well approaching 100%. I think that's a testament to the model that we're working with.
Now with this diagnosis and the support, I feel like I've had a weight lifted off my shoulders, to be honest. I just feel so much better. We know what the issues are, we know how to handle it now. It's got the right medication, and he also has a learning support teacher with him now. Without help, I wouldn't have got his diagnosis and I wouldn't be where I am now. We can actually finally move him forward and give him the best chance he can get.
Everyone's vibrant and buoyed by the fact that we actually have access to a service that we haven't had access to. It's a program that's already had impact in terms of the wellbeing side of things, but I'm sure that impact will be felt through those students' lives forever at every stage of life.
This is really a flying start. It's setting people up for a great future. So it's really important that people can support us to make sure that we have that access.
I believe we have an obligation to ensure that children living in regional New South Wales have the same access to healthcare as those living in the cities. With your support, we can make this vision a reality. Flying Start, the sky's the limit.